My wife was admitted to the surgical center for an operation, and I must say that was quite a positive experience.
The experience which I have actually with the Newham General Hospital has not been personally for myself, but I had quite a bit of dealing in attending the hospital with my father and some of the other family members as well.
I fell sick, bit diabetic since 1981. Not other illness, there is a little problem of eyesight also.
I've been to actually emergency twice. The last time was 3 years ago.
All of the GPs that I've ever had have been very nice, very helpful for my towards my health and my family's health.
I had actually 4 children at Newham General.
Newham General Hospital is very good. I've been there a few times and I've had first-class treatment.
I think I went to casualty sometime in March.
My first experience with the healthcare in Newham was a visit to the casualty department down in Newham Hospital.
My experience in Newham General Hospital is I attend outpatient quite a few times for the last few years.
Well, I didn't have a very good experience with my GP, I must say. That's why I never bothered to go. Well, he didn't seem to be interested. You know, that's what. He didn't seem to be interested.
I've not used any NHS services in the last 1 year, but the last time I had contact, it was not really, it wasn't really a good experience.
When I was in hospital, it was a couple of years ago. It was quite clean and so on. The food was fine.
My experiences at Newham General Hospital, twice I've been along there. Once I'd been attacked, somebody went for my bag and damaged my finger. The other time was I accidentally ingested some mouse droppings, and then as far as I know, I got leptospirosis.
Well, as I said again, I knew about this NUHT and about the services, so I was able to advise my wife along the way, only because I knew the services. Yeah.
When you speak to somebody of not your own origin, they try and play it strictly by the book. Sometimes there is a leeway you can try and help the patients, but on the other hand, when you hear some Asian person speaking on the phone, they become very helpful. So there is a culture barrier which needs to be broken down.
Yeah, quite accessible, yes.
On the whole, the waiting list is not too long, but not too short either, at least about 6 months before my first appointment. And also, when I eventually managed to see the consultant, either my notes is not available, or my x-ray is gone missing, or my MRI scan is not available. And then that means the consultant cannot see me, and I have to book another time until the note is found or the x-ray is found.
Well, eventually I had a letter from the hospital to go for the checkup, but that was for the cataract, which I've known for a long time I had them. So I went, and there was a Newham. Well, he asked me if I wanted Newham or also the Newham is nearer. I wish I went to the eye hospital actually now. So anyway, he wrote this letter, but without mentioning the loss of vision, which I added again several times, and I get all stripes and things like that. And now I go regular for the checking of the eye and the pressure and the cataract to the hospital.
Yeah, I think I knew during that period, I knew everywhere I had to go. I was given the name, but I had to find it out by myself. One occasion I got lost trying to look for one hospital somewhere, but I think more should be done in providing more information to locate services even when you are referred there.
Well, I'm from my GP give me a letter to go to the hospital, and then from there everything fall into place.
I think it was excellent. You know, there wasn't a stage during that process where things weren't explained to us. You know, so we felt very comfortable. We can speak to the staff, and I must say it was a very, very positive experience. Yeah.
Absolutely marvelous. In fact, sadly I can say that my father passed away in his illness, and I was so taken aback with the care given by the staff when he attended the hospital. Most of them were from African origin, and there were some in English and also East European. I had to go back and actually thank them.
For other facilities are alright, but the staff is very, very slow. I don't know. They are busy. They are going this side, this side, this side. They look to me very busy.
All very pleasant, all very nice.
They were very kind, through thick and thin, kept me happy, just basically looked after me.
The staff were very busy, and you feel like whatever you had to ask may not be important enough, and you could be slowing them down.
Oh, they are very good, very, very helpful. The nurses and specialists and consultants are all very good.
The staff was friendly.
The staff are excellent. They are doing the good job, but to get to be seen, that is the difficult bit is.
They're very nice. All of them. Very helpful.
Yeah, the staff are nice. They are friendly, accommodative, so that's okay.
The staff was fine. The staff was understanding and so on. I don't know for now, but in my time, they were.
I thought the staff, they're all very pleasant, very competent, didn't leave with any lingering doubts. So yes, they're very competent.
I know there have been a number of improvements in the past, and improvements are still going on. Hopefully it will come out looking even nicer.
General atmosphere is alright, building is very nice.
2000 I was last there. It wasn't in good condition. There was blood stains on the walls and on the floor.
The buildings, yeah, okay. I was there last week. I saw the new part, you know, just opened. It was all very posh.
Well, a lot of buildings, they need improvement.
What came to mind was private hospital. Because it was new, everything in the place was so brand new, so clean, so inviting, that I didn't really want to leave after a couple of days. I didn't want to go home.
I think the building's great. I think Latino is very modern. I think you can't appreciate how big the building is, because I think Latino is, you need to go across to the A13 to see how huge it expands to. But no, the building's great. The facilities, i.e. the quality of the facilities, etc., is very good.
I think that the waiting areas, if it will be better if there are more ventilations. Sometimes there are more seats, but the toilet facility is very, very poor.
Oh, I think it's all right myself. I think it's all right. Yeah. They changed the department the last time I went, so I don't know much about that department yet.
Most of the building are old, but externally they look old, but interior wise, I think they they've done some good cosmetic job, but I think things could be better anyway.
All right, but now I see that they improve a lot.